Welcome to today's program titled Half an Hour for Healthcare, Part 2, Flexible Staffing. At this time, all participants are in a listen-only mode. For those of you who are logged into the web presentation, you are encouraged to submit questions throughout the program by typing them into the Q&A box on the right-hand side of your screen. For those interested in obtaining CLE credit for this webinar, a CLE attendance verification code will be read later in the presentation. Please write this code down as it will not be reread and is required on the CLE credit request form. During the presentation, you will see a slide with a QR code that you may scan to access and submit your request for CLE credit. You can also find a link to the form in the connection details email you received this morning. Copies of the webinar recording and materials will be distributed to all attendees in the days following the webinar. On the next slide, you will see a legal disclaimer. This presentation has been prepared by Seyfarth Shaw LLP for informational purposes only. The material discussed during this webinar should not be construed as legal advice or a legal opinion on any specific facts or circumstances. The content is intended for general information purposes only, and you are urged to consult a lawyer concerning your own situation and any specific legal questions you may have. At this time, I would like to turn it over to our first speaker for today's program, Bailey Byfoss. Bailey, please go ahead.
Thank you, Donna. As Donna just shared, my name is Bailey Byfoss. I am a partner with Seyfarth in our San Francisco office up in Northern California. And my practice primarily is focused on wage and hour issues in the healthcare industry. So this is exactly the right spot for me giving this presentation. I do sort of additional work as well in the employment space, but when you drill into it, most of what I'm doing these days is wage and hour healthcare stuff. And with me today is Ashley Stein, who is a Rockstar associate in our LA Century City office. Ashley practices in a variety of employment law spaces, which means just that she is able to hold far more thoughts in her brain than I am at any given moment. But she does a great job sort of counseling folks, including healthcare companies, on a number of issues that are facing our healthcare clients. Hannah, if you could go to the next slide, please. Today, you will probably know you registered for this program. We're going to be talking generally about joint employment considerations, specifically with respect to the healthcare industry and specifically with respect to some of the flexible staffing models that we see often come up in the healthcare industry. If you have been here for a while, you may have been to one of these webinars in the past. We've been hosting them for a couple of years now. We keep them to about half an hour in length, get you in, get you out, on a topic that is generally tailor focused to the healthcare industry. And usually the way that this works is there's something related to employment law, wage and hour, whatever the sort of topic of interest is. And we talk about that topic and we talk about the ways in which it impacts the healthcare industry specifically. Because in California in particular, where Ashley and I both practice, the healthcare industry is highly unique in the employment law space. I say this all the time. You guys are subject to special rules, special regulations, and then on top of that, the generally applicable rules and regulations affect healthcare companies in a way that is really unique. So that's what we're going to be doing today. You can see our agenda. We've got three sort of primary topics that we're going to go through today. The first one is the very first one is just making sure that everybody's on the same page about what we're talking about when we refer to flexible staffing models. Ashley's going to talk a little bit about that. You probably have your own sense of what we mean when we say flexible staffing models. But we're going to get everybody on the same page, make sure that we're talking about the same stuff. And then we're going to move into some specific joint employment considerations when you are dealing with staffing companies, other entities that are partnered with you in these flexible staffing programs. We're going to talk about common wage and hour issues that come up in the joint employment context, because that can be a complicated area for folks. And then nobody likes to be in litigation. That's never plan A. But it happens. And we want to talk about some of the defensive litigation strategies that you are often going to see come up when you do find yourself in litigation with one of your flexible staffing partners. So as Donna said, feel free to drop any questions in the chat as the day go, or as the presentation goes on, as the 30-minute presentation goes on. My email address and Ashley's email address are also on one of the last slides in the presentation. You can also feel free to reach out to us after the presentation whenever you like. But with all that being said, I will pass it over to Ashley to kind of get us level set with the next few slides.
Thank you so much. So yes, as Bailey mentioned, I'm an associate in the Los Angeles office, and I do a fair amount of healthcare work. And one of the things that we are coming across a lot is this idea of flexible staffing. And I think it's become very, very popular since the pandemic. I know there's always been kind of a concept of flexible staffing in healthcare. And Donna, you can go to the next slide. Thank you. There's always been some examples of flexible staffing in healthcare, things like per diem nurses. Internal flex or float pools are pretty common. Again, I think a lot of these really came into focus during the pandemic and afterwards, when all of a sudden healthcare facilities really, really needed a lot of extra staff on a short-term basis. And so a lot of what we're going to be talking about today is examples of external flexible staffing. And so these would be flexible staffing provided through generally like a third-party agency. So a third-party employer, temp agency, staffing agency. They go by a ton of names. I don't really think the names are necessarily representative of what they are, but generally what the effect is they're going to be the agency that is employing the flexible staff and then making them available for use at the healthcare facility. And so, as I mentioned, a lot of this, we see this most commonly in terms of travel nurses. And these can be nurses who go from hospital to hospital within the same area. They can go between state to state. We have definitely seen examples of nurses going across the country, again, kind of as the need dictates. But it doesn't necessarily need to be just nurses. This could also be sort of ancillary services. So anything the hospital needs or the healthcare facility needs to provide services to patients, like janitors, food service, even potentially administrative services behind the scenes. These could also be provided by flexible staff if needed. So there's a lot of ways that this could come up in the hospital environment, and you just want to be aware of all of the considerations that go with that. It seems really easy and great and wonderful, and in some ways it is, but because especially in California we have a lot of laws, in some ways it's not. And that's what we're here to tell you about. Donna, you can go to the next slide. So why are healthcare facilities using flexible staffing? I think probably everyone has an idea of this at this point, but really helps address urgent staffing needs, right? I think there's a lot of times when during the pandemic, especially, but as I mentioned, even now, sort of cold and flu season, just unexpected issues. I'm thinking like the fires in LA, there are probably hospitals that needed extra staff for extra patients coming in. There are times when hospitals and other healthcare facilities need to increase headcount very quickly. And these flexible third-party staffing solutions can offer that. And so the big benefit, of course, is they can, if they're hired by a third party, by the time the healthcare facility needs them, the third-party agency has already hired, background checked, vetted, gone through onboarding, and hopefully the flexible staff are basically ready to jump in. And that's great because in a situation where you need additional staff, you really, really need it, right? You need it for patient care. You need it for patient care. You need it so your existing staff can get their, can take days off, can get their breaks, can do their jobs to the best of their ability. So it helps not only with providing the best possible patient care, but also with keeping your existing employees happy and willing to stay, right? I think one of the biggest challenges that healthcare facilities face a lot of the time is employee turnover. And so this can really, really help provide support in ways that the facility needs it and allow you to have better retention rates and just general morale among your existing employees. There's also situations where flexible staff can provide specific services that your existing staff may not have the skill set for. And that can be particularly helpful, again, in times of need where you know you're not going to need this type of skill set for a long period of time. And in that scenario, flexible staff can be available to come in, contract for a short period of time, right? And the healthcare facility doesn't have to go through the process of, say, laying off employees, right? Nobody wants that, not great for anybody. So allowing flexible staff to come in and fill those needs really benefits both the healthcare facility and the flexible staff members. And that's the other big thing. This is very appealing, right, to a lot of nurses, a lot of providers, because they can choose when they want to work, where they want to work, how long they want to work. So you're going to attract staff that you wouldn't otherwise be able to get. So that being said, there's a lot of great things about flexible staffing, right? But as we mentioned, it does come with some legal challenges that we want to be aware of. So I am going to turn it back over to Bailey to discuss that. And Don, I think you can move to the next slide. Oh, Bailey, I think you might be muted.
Thank you. Don't know how that happened. Donna, you can actually go ahead to the next slide as well whenever you're ready. Thank you very much. So we are going to be talking mostly about joint employment considerations, and what do we mean when we talk about that? Think about the travel nurses that Ashley was just describing. Think about a hospital environment. You have travel nurses that are on site working at your hospital, treating the patients who are there in your hospital, possibly next to the nurses that you do employ that are also working at your hospital. Who is responsible for those travel nurses in all of the ways that are important and matter for purposes of California employment law? So it is always my goal in these presentations to not lecture you guys about what the law says, because people find that very boring, including me, frankly. But I do think that some of this it provides important context, because if you don't know what California courts and agencies, plaintiffs' lawyers are looking for when they are evaluating whether you are in a joint employment relationship with your staffing companies, with your flexible staffing partners, then you don't know sort of how to mitigate your risk in that way. So I'm going to try to not spend a ton of time here, but there are three sort of main scenarios that three main definitions that California looks at when it considers whether somebody is a joint employer. And those are if the entity involved exercises control over the employee's wages, hours, or working conditions, if they suffer or permit them to work, or if they, quote, engage them. To exercise control over somebody's wages, hours, working conditions, you're looking at stuff like who has the authority to hire them and to fire them and to discipline them and to decide how they're going to be compensated and how much they're going to be compensated and how they're going to be classified. Who is assigning them tasks? Keep in mind that courts here are often looking at who has the power to control this stuff, even if that power ultimately goes unexercised. Suffer and permit to work. Employees are working under the suffer or permit clause if they're spending time performing tasks that are work. If they're doing work, then they are being suffered or permitted to work. A good example here is really unauthorized overtime. I mean, lots of employers see this come up. Your employee is scheduled to work 9 to 5. They're not supposed to be working overtime. But today they stuck around until 5:30 and they incurred a half an hour of OT. You didn't ask them to do that, but they did it. And now that you know about it, employer, you are required to pay for it. So whether a business has the ability to suffer or permit an employee to work or to prevent an employee from working can be a really relevant consideration. To engage, this is really like sort of the old school common law definition, and ultimately just comes back to whether the putative employer has the right to control the details of the employee's performance. So how much control does the business exercise over the details of the worker's work? Is it being performed under the direction of the business or independently by a specialist? The example that I always think of here is a painter. Like, if I hire a painter to come and paint my house, is that person being directed by the painting company or are they being directed by me? Right? If I hire somebody to come and fix my oven, are they being sort of directed by the company that employs them or by me? They're not, in that instance, they're really not being directed by me. That's very much an outsourced situation for me. Stay out of the way. Section 2810.5 is on here because this creates special liability for client employers. A client employer is an entity that obtains workers from a labor contractor to work within the entity's usual course of business. Client employers statutorily share with labor contractors all legal responsibility and liability for non-exempt workers in connection with the payment of wages and the securing of workers' comp coverage. So that's one that warrants special mention given the topic that we're discussing. Donna, if you would move to the next slide. And we're going to talk a little bit about the ways in which this comes up in the wage and hour context, but I want to flag some of the specific things you're going to look for in the context of whether you are considered a joint employer in the healthcare industry. First one, you already heard me mention, hire onboarding. Who is doing this? Who is making decisions about who gets hired? Are you picking people or is the staffing company just sending you somebody? Staffing company sending you somebody within a strict set of parameters that you have defined? Or like, how is that happening? It's not on here, but think about termination in the same way. One of your travelers isn't complying with hospital policy. What happens to them? Do you have the ability to unilaterally terminate their employment? Or are you just asking the staffing company to reassign them, do something else with them? They can't be here anymore. Training policies, this one is hard in the healthcare context, right? Because in some industries, you have, frankly, fewer rules. Maybe the staffing company has their baseline policies doing stuff like prohibiting discrimination and requiring regular attendance and sort of basic, be a good employee stuff. And you can rely on those and you don't need to supplement your own, you don't need to supplement the temporary employer or the staffing company worker. You don't need to supplement the way in which they're doing their job with your own policies, right? Does that work for a hospital? I mean, can you have a nurse working at your hospital who is not bound to comply with the policies governing that hospital? It's harder. It's harder in the healthcare industry to be removed when it comes to things like training and policies and things like that. Arbitration agreements, we're going to come back to that at the end because I want to spend a minute having a dedicated conversation about that. Day-to-day management, in a perfect world, if you are really trying to avoid a finding of joint employment, your staffing company people are managed by their own on-site manager. They're their own little fiefdom, where the staffing company supervisor is in charge of managing the staffing company employees. Does this happen in practice? It certainly can, depending on the circumstances. Handling of complaints. Say there is no staffing company supervisor and the staffing company people are reporting to one of your managers. What do they do if they have a complaint about that manager? Are they coming to your HR team or are they going to their HR team? Because if they're coming to your HR team, that is something that will make it more likely that you are going to be found to be a joint employer. Record keeping, I mean, that is what it sounds like. Who's keeping the paperwork on these people? Who's keeping their stuff? Wage and hour stuff in particular comes up in this space, and I'm going to kick it back to Ashley to spend a few minutes talking about that.
Thank you. Donna, you can move to you can actually do 2 slides if you want. Thank you. Yeah, so thank you, Bailey. As Bailey mentioned, there are a fair number of wage and hour issues that come up in flexible staffing arrangements, as you can imagine. A lot of these really do go to if a court were looking at whether the healthcare facility is a joint employer of the flexible staff. So you really do want to be aware of these kind of on a day-to-day basis and just make sure that you're keeping track of them. Bailey will talk about this a little bit more later, but these are all going to be things that you want to put in your agreement with the staffing agency, if to the extent you can, to the extent it's feasible, you want to make sure you're clear on who's responsible for these things. So first and foremost, timekeeping. Flexible staff, you want to be sure that in some way they are tracking their time. A lot of times this is done, especially if you're familiar with staffing agencies, temp agencies, this can be done by the staffing agency, the employer of the flexible staff. It can be done either via the flexible staff using the healthcare providers or facilities timekeeping system and then having those records sent to the staffing agency. Or if you are wanting to give yourself one of a better defense against joint employer liability, it can be done by having the staffing agency give you its own time, put in its own timekeeping mechanism. So like having its own time clocks there. This kind of goes along with the on-site manager thing. It would be helpful from a joint employer standpoint, the less control that the healthcare facility is exercising over the flexible staff on a day-to-day basis, the less likely it is that a court would find that they are a joint employer, right? So timekeeping is a big one, seeing as the vast majority of the personnel we're talking about are going to be non-exempt. So the employer of the flexible staff is definitely going to have an obligation to keep records of their time. That goes for regular time, overtime. And so you're just going to want to be sure that someone is keeping record of this. Relatedly, you want to be sure that those records are being stored by someone for the appropriate time period as required under California law. I have heard before, oh, we can't get those records. That's not a stellar defense. I don't love to have to argue that. So just make sure, especially that if the staffing agency, the employer, is the one that has those records, try to make sure that you, the healthcare facility, can at least get access to them if need be, and that they are being stored for the appropriate amount of time in case you need them. Similarly, this kind of goes along with this, but payment of wages. So generally speaking, in the third-party staffing agency flexible staff arrangements, the staffing agency is going to be paying the flexible staff's wages or pay directly. To the extent you want to avoid joint employer liability, you definitely, as a healthcare facility, want to avoid paying them directly. So that's a pretty big one. But you also want to make sure that that you have an idea that they're being paid correctly, right? As we all know, California has laws about how often you have to pay, when you have to pay, that sort of thing, overtime requirements, things like that. You just, as the healthcare facility, you just want to be sure that you have an idea of how your flexible staff is being paid, that they're being paid overtime. We're going to talk in a second about meal and rest breaks, things like that. You're going to want to make sure they're being paid correctly and that we have record of that. Additionally, scheduling, you just want to know as the healthcare provider, you want to know how your flexible staff are scheduling shifts, right? I think in a traditional sort of per diem context where they're your employees directly, the healthcare facility is saying, hey, we need you, 3 days this week, and then not at all the next week. In a third party flexible staffing arrangement, a lot of times there are now things like a website where the third party staff can just say, hey, I want to work these 3 days at this location, right? That's great. From a joint employer standpoint, that is helpful to the healthcare facility because the flexible staff is actually choosing all of that. So there are just a lot of options to keep in mind. Donna, we can go to the next slide. As I mentioned, meal periods and rest breaks, you do want to make sure, kind of again, as Bailey was saying, the hospital's policies are going to be in place for its employees. And so you're going to have flexible staff placed in these same departments and things. They are, you want to consider whether you're going to have them getting meal periods and rest breaks under your policies, whether the staffing agency has its own separate policy, right? Especially if there's an on-site provider or on-site supervisor, you want to make sure that you understand whose policy they're supposed to be following, everyone's, no one's, don't make it no one's, that would be a bad idea. But you also want to make sure that that meal periods are being tracked, right, in accordance with California law. So that goes along with the time records. Again, it doesn't need to be the healthcare facility tracking it. It could be the third-party agency, but you just want to know, right, who is handling that to make sure it is being handled. And last but not least, business expenses. Hopefully this won't come up that much in this context. I know most healthcare facilities are pretty good about providing everything, especially nurses might need. But just to the extent you think your flexible staff might incur any business expenses, be aware of that. Consider who's going to handle reimbursement of those, whether it be the healthcare facility or the third-party agency. Again, to minimize joint employer liability, you want it to be not the healthcare facility. All right, so I'm going to turn it now back over to Bailey. We've talked a lot about how to try to minimize risk. We're going to talk a little bit now about what happens if you do actually get to litigation, which we hope you don't. That's what we're here for, but it does happen.
Yeah, and I'm not going to keep you all past the 11:30 marker, so I'm going to be super fast and really get to the point about this, which is Donna, if you go to the next slide, we really, we like to save our strongest point for last, which is contracts. Everybody's favorite thing in the world, right? Contracts. Who doesn't love a good contract? Two that you want to keep front of mind when you are dealing with your flexible staffing company partners. One is your contract with the flexible staffing partner that you have. Whatever it says, I mean, like there's lots of room to negotiate the terms of what it says, obviously. But you just want to make sure that it says what you want it to say. Like that seems really obvious, but like if you are trying to avoid a finding that you are the employer of the people who are staffed by this partner, that should be built into that contract. If you want indemnity for issues that might arise with respect to the folks that your flexible staffing partner is placing on site, you need to make sure that there is indemnification language in the contract. Like whatever the contract says is what the contract says, but make sure that it says that it says what you want it to. The other big thing that you want to keep front of mind is, is there an arbitration agreement with the folks that are being placed on your site? Should you have one? It depends. If you have one with respect to your employees, to the people that are directly employed by you, there's probably a pretty good argument that you want it with respect to the people that are there. They're being placed there by the staffing company as well. There is two things really that you want to look for in that. One, make sure that it has the most up-to-date language with respect to class waivers, and if you are in California, PAGA waivers, PAGA representative action waivers, make sure that it's got that. Number two, make sure that agreement between, and I'm sorry, I should have said this at the beginning. in an ideal world, that arbitration agreement is coming from the staffing company itself. That agreement is between the staffing company and the people that are being placed on your site there. But you still want to look at it. You still want to know whether it exists, and if it does exist, what it says. And in an ideal world, it's got the most up-to-date class action waiver language in it. It's got the most up-to-date PAGA language waiver in it. It's got language regarding intended third-party beneficiary. Specifically, what you want that to say is something like the hospital or XYZ company, or if it's less specific, something that's like any company at which you perform services through us is a third-party beneficiary of this agreement. Why do you want that? You want that because that is your best chance at enforcing that agreement in the event that the staffing company employee brings a lawsuit against you. If the staffing company employee brings a lawsuit against the hospital where they're placed, and for example, decides not to name their actual staffing company, which happens, having that third-party beneficiary language in the contract is your best shot at enforcing that agreement. And so take a look at it, know whether arbitration agreements exist between the staffing company and their employees, and make sure that you get a copy of them to look at that. And check for the third-party beneficiary language. I told you I wasn't going to go over. It's 11:31. I'm so sorry. Donna, can you skip ahead a couple slides, because we will give you the CLE code. And the attendance verification code is up there. It is SS, like Seyfarth Shaw. Took me longer than it should have to figure that one out. SS 3805. Again, that is SS 3805. You can scan the QR code that is up there. It'll prompt you to go to a little form where you can fill out the information here that includes the attendance verification code. Again, Seyfarth Shaw, SS 3805. I only went 1 minute over. Thank you everybody very much for taking the time to come and listen to our presentation today. We will leave the next slide up for a minute. It's got my email address and Ashley's email address on it. If you have any questions, please don't hesitate to reach out. Please feel free to get a hold of us, contact us. Otherwise, thanks again.